Hey, what's up everybody? Welcome back to my channel. My name is Tamisha, also known as Mrs. Coda. So in this video, I'm going to talk about 6 thermal modalities that you can use to help decrease pain for your patients right now in the clinic. So if you're interested and you want to know more about this and you're like, I wonder what I can use as a practitioner to help my patients decrease their pain, which is an often complaint, then you definitely want to stay tuned for this video. All right, guys, so let's jump into this. So what I'm going to do, I'm going to give you these 6 thermal modalities that is often used. I've used them myself. Some of them I have not used, and I'll let you know which ones. But here we go. Let's jump right into it. So the first one that I'm sure everyone is familiar with is hot packs. Yes, hot packs. So hot packs is a vasodilator, and that increases the blood flow, which improves in circulation. It decreases tight muscles. It relaxes muscle tissues. A lot of times we will use hot packs for preparation for, let's say, passive range of motion. If there's a spastic extremity, we'll also use that as well. And sometimes your patient just loves the feeling of having a warm compress on their bodies, so it's a nice thermal modality that you can definitely use with your patient. The second one is called cryotherapy. Okay, that is like the medical terminology. I simply called it cold packs, right? Or cold therapy. Yes, cold therapy. And this is also a superficial thermal modality that you can use for your patient, which decreases pain associated with swelling. It is a vasoconstrictor, and it decreases inflammation, right? This is going to also help with spasms, muscle soreness. You can definitely use this with contrast baths or sprains. And if you're familiar with contrast baths, it's usually you'll go from hot and then cold, hot and then cold. If you want me to do a video explaining more detail about what a contrast bath is, I can. And that would not be a problem. The third superficial thermal modality on my list here to help decrease pain in patients is Whirlpool. Yes, Whirlpool. Now, I never used Whirlpool before, but I am familiar with it, and I do know a therapist that has done this in conjunction with nursing. Whirlpool is good for decreasing swelling. It also helps to control inflammation. It helps to decrease pain and muscle spasm. And one thing that I witnessed that it was used for was wound cleaning. Yeah. And this is for burns. It's the removal of necrotic cellular debris. It also helps with contamination of the wound site to prevent. So that is really cool that you can use a Whirlpool to do that. Number 4 would be fluid therapy. Fluid therapy, also known as dry whirlpool or heat steam air. And this increases range of motion, right? It helps with tissue healing. It's great for arthritic hands, fingers, wrists. It decreases stiffness, pain, and edema. All right. Number 5 is paraffin bath. I have used this before. I think it is great. I've even used it on myself when my hands or my fingers start to hurt from like typing a lot on the computer. But paraffin bath is great for arthritis, arthritic hands. It helps to decrease the pain. It relaxes the muscles. Like I said, it's usually used for the hands as well as for the feet. And it's like a wax that you that goes on the hand. So when you're doing it, let's say if you're using the hand, what you want to do is you're going to dip it in the wax there, like about 3 or 5 times. Usually I believe it's 3 times. Every time you dip and you bring the hand up, you kind of give it like 3 seconds before you dip it back in. And then usually what I would do is after I do that, I will wrap the hand, and then the person will sit with, let's say, a warm compressed around it, or they'll just sit with it wrapped. And then when you peel it off, you kind of massage it, and it really helps with bringing down pain as well as swelling. And number 6 is ultrasound. I've used ultrasound as well in the past. Ultrasound is great for contracture management. That's what I've used it for. Pain reduction, edema reduction, tissue healing, it improves recirculation. I've used ultrasound, in conjunction with splinting, and that's something you can definitely do. So I hope that these 6 superficial thermal modalities has been helpful for you. I would love it if you can leave me a comment below and let me know, hey, Tamisha, I've used this in my practice and it provided this particular result. That would be great feedback. Definitely you want to know how to use these, because the last thing you want to do is hurt your patient. So definitely achieve service competence before you start using these superficial modalities. All right, if you like my video and you want to know more, just definitely leave me a comment below. If you have a question, or there's, let's say there's something you want me to cover, go ahead and definitely leave me a comment below. Until next time, guys, bye-bye.